Satisfy your curiosity. Read. Learn. Try and understand what drives, what's successful. And also understand that it's not about authority. It's about influence. It's about how you influence others to achieve an aim. How do you engage with them? And lots of times with young leaders, especially in their first management position, they confuse the tools and aspects of management with leadership. In management, you have to budget, you have to have resources, you have to staff, you have to problem solve. You can do that with a team of people. But ultimately, to achieve something bigger rather than simply day-to-day operations, is you have to actually lead them. You can manage assets, but you have to lead people. It's not based on personality, all right? And it's based upon knowledge. And so, if you're the manager of a diagnostic imaging unit, and there are a lot of managers now that are non-clinical, and especially in large organizations. They're young people that just graduated from an MBA program. They've been given, management responsibility for all diagnostic imaging. Then, and the people working there, the techs go, what does this person know about what we do? And I was really, really lucky in my career. When I was 25, 26, I was sent up to be the interim administrator in a small hospital north of Austin, Texas, near Waco, Texas. And I asked my boss and mentor, I said, well, what do you want me to do? And he said, I don't want you to do anything. I want you to go up there, and if something needs to be done, you'll see it. But what you really need to do, what I really want you to spend your time doing, I want you to go talk to the patients. I want you to go talk to the doctors. I want you to spend your time talking to the board. I want you to spend your time talking to the employees. Understand what they're doing. Understand what they're up against. So I went there and spent a couple months as the interim administrator with no agenda about doing anything, but it set a pattern for me personally around leadership that said, get close to the work. And an authentic presence is about getting close to the work. It's about understanding what is done in your department, understanding how it's done, understanding what you produce, and then that creates authenticity, all right, with those that work with. Because if you really know what's going on from and I would say that not going on from a interpersonal spat basis. I'm talking about really what's going on, about what the work's about. Then that's the first foundation. And then when it comes to improvement and driving improvement and innovation, then really knowing how to improve, know how the methods work, know how the tools work, be able to talk about teams and be able to talk about teamwork and process and apply those tools. So so you may have, and you're the leader of diagnostic imaging, you might have an improvement team that's led by one of your shift supervisors. Well, that improvement team needs to they need to know that you actually know how to do this. And that only comes from building your own personal knowledge. And that's what creates the authenticity, if you know what the work's about.